Hi, my name's Dr. Carol Gedenberg. I'm a pediatrician in Boulder, Colorado. I hope you enjoy this video. There are some over-the-counter medications that are safe for children who are 6 and older, and also for adults. First, I'm going to talk about decongestants. The best decongestant out there, or at least the strongest one, is pseudoephedrine. It's brand name Sudafed. You have to buy that from a pharmacist. That's the one that you have to show your driver's license in order to purchase. The pseudoephedrine is great at drying up your nasal passages. So if you have an irritating drip, a postnasal drip, or a nose that's just running like a faucet, pseudoephedrine is a great way to cut that. The side effects are that it can make your heart race, and if you have a heart condition, it might not be safe, so check with your doctor before starting that. Another great decongestant is Afrin nose spray or oxymetazoline. You can get the store brand and it works just as well. The oxymetazoline is another potent, it's a vasoconstrictor, meaning that the blood vessels in your nose will shrink up, and that's where all the fluid is coming from, is just leaky capillaries in the nose. So the oxymetazoline is locally acting. It doesn't really get into your bloodstream. It mostly just acts in the nose, and it dries up that leaky, runny nose that's running like a faucet. It works for 12 hours. Now, the downside with decongestants is that you can only use them for 2 or 3 days at a time. If you use them any longer than that, then you're going to get what's called rebound, which means that your blood vessels stop reacting to it, they stop shrinking up, and they actually will get worse and start leaking more fluid into your nose. So remember, only 2 or 3 days for decongestants. As far as cough suppressants, the one that I usually recommend is dextromethorphan. It's in a lot of different cold preparations. Dextromethorphan, abbreviated DM, is one that works in your body. It kind of soothes your cough receptors, and it tells your body, hey, we don't really need to cough, it'll be okay. And it can keep an infection in. If you are having a productive cough and getting things out, it's better to cough things out. But if you have a cough that's keeping you up at night that you just can't stand, you can try dextromethorphan. Remember, that's only safe for children 6 and older, and also for adults. Guaifenesin is a mucolytic, meaning that it thins out your mucus. The way guaifenesin works is it causes your body to actually produce more fluid and thin that thick, hard mucus out. So if you have any mucus that's caught in your nose that's really thick and yellow and green, or you feel like there's something in your chest and you just can't cough it out, guaifenesin is a great one for that. The brand name is Mucinex. Guaifenesin, remember that because it is thinning the mucus out, you don't want to take it with a cough suppressant, and you don't want to take it with a decongestant, because those will fight against it. So if you take guaifenesin with a cough suppressant, you're just making your mucus thinner and also harder to cough out. If you take it with something, with a decongestant, that's trying to dry you up, and the guaifenesin's trying to moisten the mucus. So they'll just cancel each other out, and all you'll get is the side effects from the medication. So check your cold preparation. Look to see what ingredients are in it. If it contains guaifenesin with dextromethorphan, or guaifenesin with pseudoephedrine or phenylephrine, I don't recommend taking it. Remember, a lot of over-the-counter cold preparations are actually produced by pharmaceutical companies and not by doctors. So they don't necessarily realize what they're doing on a molecular level. So just be careful, read the ingredients, and see what will work best for you. A lot of cold medicines also contain antihistamines. Now, antihistamines are great if you have allergies, and they're shown not to do very much if you don't have allergies. They will dry you up a little bit. Some of the common antihistamines are doxylamine or diphenhydramine. The diphenhydramine brand name is Benadryl. Those tend to be sedating. One reason they put them in cough medicine preparations is to help you sleep at night. So if you're having trouble sleeping because of the cough, it can dry you a little bit, but mostly what it's doing is helping you to get some good sleep at night. Remember, rest is one of the best cures for a cold. Thank you for watching. I hope you have a great day.
When going to the doctor just won't do, doctor at your door is there for you.